Welcome, everyone. We're so pleased to be here today for this CanWatch Global Health Impact Exchange session. The session today is called Working in Male-Dominated Spaces to Achieve Gender Transformative Health Outcomes. I'm Anu Kumar. I'm President and CEO of Ipas. Ipas is an international NGO working across Asia, Africa, and Latin America to expand access to abortion and contraception because abortion is healthcare and we believe that everyone must be able to determine their own future. I'm really happy to be here today with colleagues from Plan. Let's take a moment to introduce ourselves and in our group here. First, let me start off with my colleague from Ipas, Cecilia Espinoza. Cecilia, please go ahead and introduce yourself, and then we'll turn to our Plan colleagues before I give a brief introduction to the panel itself.
Thank you, Anu, and thank you for the invitation. My name is Cecilia Espinoza. I work for Ipas as a senior advocacy advisor in our technical excellence department. So now let's hear from Dr. Atta.
Thank you, Cecilia. So I think I'm quite pleased to be here, especially to be talking about such an interesting topic, male-dominated spaces, gender transformative programming. So I'm currently the head of social development program for Plan International Nigeria. I currently work with my colleague Aaliya, working from our Canadian office. In the last couple of years, I think we've tried to implement different projects to promote gender transformative programs in Nigeria as well. So I'm quite pleased to be able to be on this platform. Thank you very much. Aaliya, do you want to introduce yourself? Thank you.
Absolutely. Thank you very much, Dr. Atta, Anu, and Cecilia. It's so nice to be at this forum today and talking about a like-minded opportunity on working in male-dominant societies. And just like Dr. Kabiru said, working with males through male engagement and working through a gender transformative approach is a niche that we are all looking and working towards in all our programming, which includes maternal newborn child health and sexual reproductive health and rights, especially for adolescents. I am Dr. Aaliya Bibi, and I work with Plan International based at Toronto as a senior health advisor alongside my counterparts in different countries in Southeast Asia, Africa, Latin America. Happy to be here. Thank you, Anu.
Thank you so much. So let's just start off with a brief introduction on, why we're here and why this topic is so important. Gender power dynamics have serious implications for sexual and reproductive health and rights of women and girls. Of course, supportive policies, services, social norms, communities are all vital for girls and women to be able to act on their rights. And although gender equity is a human right, we know that in many contexts, women and girls do not have the autonomy, the safety, or the freedom to exercise those rights. So at Ipas, though we are focused on abortion and contraception, we view our work holistically. Our work is to change gender norms, and that work involves removing barriers that adversely affect women and young girls. We also promote equitable relationships and decision-making at the family and household level. And we believe that increasing economic and educational opportunities for women and young girls will also improve their lives and their health. Gender inequalities arise from systemic, differential, and unequal treatment of women as compared to men. And those inequalities occur in the economic, social, and political spheres. And those institutions also reinforce social or cultural norms that value men over women and girls. Inequitable gender roles and harmful social practices can be seen in such things as violence against women, unsafe sexual relations, barriers to healthcare, including abortion and contraception, among many others. So a gender transformative approach to sexual and reproductive health and rights takes into account the context in which an individual lives, the circles of support from family to community to society. These circles can also be barriers that prevent women and girls from being able to exercise their rights and make decisions. One way to reduce barriers and to create more support for women's rights is to work with men. We work with men at Ipas to educate them on the importance of gender equity and the crucial role that they can play as partners, as family members, as community leaders, and as professionals. And this is the focus of our session today. I'm now going to turn it over to Cecilia to share more information and details about how Ipas is doing some of this work in Bolivia. Ceci?
Thank you very much, Anu. So as Anu was explaining, for us it's very important to remove barriers to abortion because obviously this is very important for women to be able to make the decisions around their reproductive life. And so we think that working with men, it is a key strategy. Men are members of our communities and realities like Bolivia and other countries in Latin America and across the world. We know that the military, it is a very important institution that is not only, present in our life in different ways. And this is why it's also very important to work not only with the military, we also work with the police in other countries, like for example, in Ghana, in Malawi, in Nigeria, and in other countries where Ipas works. So in our work, specifically in Bolivia, what we have been doing is to address the fears and the misconceptions around gender, around reproduction, sexuality, abortion, because these are key elements to ensure that men are going to be supportive partners in ways that benefit women. Specifically, the work that Ipas Bolivia is doing includes training new classes of military recruits on harmful male stereotypes and how men can challenge this culture of toxic masculinities to be supportive partners and advocates for women's reproductive rights. Sometimes when we think about this work, we may think, okay, this is just a specific to men who are in the military, but we know that they're members of their communities. They are young men that also will have an impact or an influence on their peers. Once they get out of their classes and also their work in the military, they come back to their communities where they also create their own change. And this is why this type of interventions are critical, especially in a country like Bolivia, where the population is very young, and the military is also one of the spaces where they see as an opportunity also for their own education and professional development. So, for me, the most important thing is that we also hear from my own colleagues in Bolivia. And today we're going to have a video from Malena Morales, who is the director of Ipas in Bolivia. And also we are going to be hearing the testimony from the Colonel Jorge Salim Guzman Bustillos, who will be also sharing his experience about working with Ipas on this topic. So thank you.
La decisión de Ipas de trabajar con el enfoque de masculinidades está relacionada a que los cambios importantes que podemos contribuir en las relaciones sociales no solamente involucran a las mujeres, sino también deben involucrar a los hombres.
Sí es importante promover las masculinidades y nuevos roles. Antiguamente siempre hemos visto que toda la carga le dábamos a la mujer, ¿no? Ella era la responsable con los hijos, ella era la responsable con los partos, ella era responsable en la casa con la educación de los chicos. Pero vemos que actualmente ha cambiado esta situación y que el varón tiene un papel muy importante en el seno de la familia. Ya no es solamente la mujer que tiene que preocuparse por la educación de los chicos, es también el varón, el papá. Antiguamente, decirle a un varón, no te cuides para no embarazar a una mujer, era pues ir contra su machismo. Pero hoy en día ha cambiado esa visión, ¿no? Entonces, en el cuartel pretendemos de que él cambie de forma de pensar, porque si no, va a seguir arrastrando de generación en generación, va a tener la materia de centinelas de la salud. Entonces, en una primera etapa ellos pasan la parte teórica con textos que se les proporciona a los soldados, y en una segunda etapa es la evaluación que se da de una manera teatralizada para demostrar con hechos reales lo que la sociedad vive todos los días, lo que los jóvenes están viviendo, lo que los jóvenes están con las drogas, con el alcoholismo, dos situaciones que toman parte muy ampliamente como consecuencia de esto a llevar una paternidad mala, embarazos no deseados, porque este tipo de talleres solo estaban orientados para las mujeres, sin tomar en cuenta que los hombres necesitan conocer y tener este tipo de orientación en temas de sexualidad, en temas de reproducción, en temas de anticoncepción, violencia familiar.
I hope that this video have provided more information that is going to be also helpful to understand better the work that we're doing in Bolivia with this group, young groups of military. Now I will pass it to Aaliya Bibi, who's going to be sharing more about the work that Plan is doing on this area of work. Thank you.
I'm back. Hello?
Yes, Aaliya, we can hear you. Please go ahead.
Yep. Okay.
Perfect.
So I lost track.
So we just saw the video from Bolivia, and now we're turning it over to you, Aaliya, to tell us more about your work.
Thank you very much, Cecilia. That was a wonderful video, and kind of building off of that and what Anu just mentioned earlier, I would like to talk about a little bit about Plan International Canada's work that has been graciously funded by Global Affairs Canada. It's called Strengthening Health Outcomes for Women and Children. It's a show project. We call it Show Project, started in 2016 to 21, and it aimed to address the root causes of high maternal and child mortality, including gender-related issues and barriers at the household, community, and facility level. This project has been running in 5 different countries around the world: Bangladesh, Nigeria, Ghana, Haiti, and Senegal. And it actually focuses on, like what we talked earlier about, promoting male engagement in communities and towards child health, maternal health, sexual reproductive health. And it is using one of the gender transformative strategies. It applies male engagement as a broader concept rather than a list of actions and decisions in which men should participate in the SRH continuum of care. And to talk more precisely about this male engagement, it encompasses more sort of men's subjective experiences on their motivations and relationships, and active participation rather than specific actions as indicative. And it also focuses on men's agency and relationships as distinct from male participation. Right? Because when we talk, for example, it ranges from men picking up their role in helping women with household chores and bringing up children to ensuring that women and adolescents have access to quality care and decision-making in all spheres of life. Now, when we move forward and talk about male engagement, we know that when we talk about men in societies like Nigeria, religious and traditional leaders around the world play an important role in shaping communities' life and beliefs and behaviors in the way they serve. Talking about our case in Nigeria, we similarly see religious leaders' connection to communities is based primarily on an understanding of religious scripture, religions or even other faith leaders for this matter often hold prominent position within communities. That's something that we've seen in our experience. And they can often build communal consensus around specific issues. And just like Anu, you talked about earlier in the beginning, that belief systems and institutions in which these religious leaders are embedded strongly influence community and their value system positively or negatively, particularly with regard to gender and family relationships. Religious leaders often provide spiritual and moral guidance, but also act as gatekeepers, right? So as trusted advisors to give information, whether it pertains to health or sexual reproductive rights. So religious leader may promote rigid or inequitable norms that endorse men's dominance over women, or dissuade men's caregiving, or promote practice that limit women's ability to access maternal health or sexual reproductive health, or make decisions. They may also uphold customary laws that disempower or discriminate against women, limiting their mobility or decision-making power, and regulating behavior for their followers. On the other hand, religious leaders, if worked with appropriately and rightly, can also serve as strong allies in transforming community norms and practices that hinder MNCH and sexual reproductive health and gender equality. So taking off Plan International Canada's experience, and we recognize through our work that the importance of working with these religious leaders and influencers. Our approach to male engagement includes conducting a dialogue, education, and mobilizing with traditional and religious leaders as male gatekeepers, because they are in direct contact with men around in the community. Therefore, talking about this gender transformative approach, one more important constituent that we keep in mind is that applying a gender transformative approach to work with the religious leaders requires acknowledging and situating these leaders within situating these leaders within the religious, political, and patriarchal systems, and they represent which they represent are embedded in. So for the gender transformative work with religious leaders, we engage them in their own spaces and give them an opportunity to reflect first on their own gender attitudes, because without these spaces, there is a risk that work with the religious leaders may reinforce rather than transform inequitable gender norms. So religious cultural practices often perpetuate harmful norms also. And with that in our background and that strategy in mind, what we did was that we went ahead and we focused. One of the important strategy was to focus on those gatekeepers, and that's where our work with the religious leaders comes in. There was a sequence of steps that followed, and I think because for that approach to be more successful and more tangible, we actually went ahead in Sokoto, in Sho, one of the states of Nigeria. We trained 1,495 peer educators and around 64 religious leaders that also somehow perform in the government spheres also. We train them as our traditional gender equality champions, so that they can talk about the traditional harmful practices on female genital mutilation, child early forced marriage, and reinforce male engagement towards better maternal newborn childhood and sexual reproductive health issues. With this background on what the problem was and how we approached it, I think I would like to now take the opportunity to give the mic to Dr. Atta, and I would like him to a little bit reflect on Sho's work that he's been leading within the country, and talk about promoting gender equality in a male-dominated society like Nigeria. I mean, we all understand from our experiences that it is undoubtedly a huge undertaking. So, Dr. Atta, if you could talk about some of the prevalent cultural norms and gender barriers among men and communities, and how these religious leadership led the male education not to follow harmful norms against women and adolescents. Over to you, Dr. Atta.
Thank you, Aaliya, for this. I think I just want to refer to when Anu was speaking. She mentioned about some of the barriers, and I could see how she was, linking it to the ecological model, looking at the individual barriers, the community barriers, the structural barriers as well. And I think for the Sho project, one key thing we did was to have a gender equality assessment at the beginning of the project. I think that really helped to inform and give us the right information for us to program and develop the right strategies for project implementation. In doing this, we were able to identify several barriers in Sokoto. Sokoto State is deeply patriarchal society. If you check the indices, it's quite a male-dominated society in Nigeria. They look at some of the indices, access to health services is quite poor for women. I think about less than 20% were accessing ANC at that time. Decision-making, we had women participation in community decision-making less than 10%. And we also were seeing that access to contraception was quite low, 1.1% at 2016. And when we did the analysis, we found out that there was a socialization process which had taken place over time, decades, centuries. So it has constantly been building up. And so we had men who were boys growing up in societies which were reinforcing these negative gender barriers. And of course, I mean, you can't expect them to have, to come out, better than what we expected, because they were being brought up in this environment as well. And so the idea was, how could you engage them? And I think one key thing was also to look at how men, the society had placed so much pressure on men responsibility in the fact that they had to deliver to their households. At one point when we had discussion with men, they were like, why don't you allow your wife to go to access health facilities? They were like, we don't have money. But we can't come out and tell our wives that we don't have money, because society, there's this shame and stigma that comes with it. So we'd rather tell our wives that our culture does not allow you to go home, you need to stay at home and wait for the traditional birth attendants. And I think that assessment really helped to understand, from the male's perspective, and that kind of informed our programming going forward. So we knew that this was really about power, like you mentioned, and like Anu mentioned, this is really about power, who has the power to make decisions, access to information, access to resources, and women in Sokoto, they hardly have access to the right quality information, and the men, they need that space. You see them with the transistor radios, having access to the information, access to resources. The men are really the one taking control. So I think those are some of the barriers we actually learned and tried to work with the religious leaders to overcome. So I'll pass over to Aaliya. Thank you.
Thanks, Dr. Atta. Very interesting. Thank you so much. And picking up on something that you just mentioned, tackling that power game, right? Yeah. How did we have to strategize? And I think one of the beautiful things that happened was working on the MNCH manual with Islamic perspectives, because that is what resonates, right? Bringing in what Islam and what the religion is telling them. I know we will talk about, Dr. Siddi would talk about some of his views. Can you just briefly highlight the different steps involved in working on this document, the Islamic document with scriptures, which we call MNCH Perspectives on Islam?
Yeah, I think first of all, yes, thank you, Aaliya. I think I need to highlight that the fact we had a 4 to 5 year project gave us the time to do this work, because you're talking about socialization, you need time. And so I think we spent the first 1 to 2 years building our social capital with the religious leaders, trying to build trust, working on MNCH issues, making sure people had access to services, getting the right balance of relationship. And I think over time, once we had that in place, we're able to do an analysis of the religious structure in Sokoto, and we realized that there were 3 different sects in Sokoto. There was also the government Ministry of Religious Affairs, who had the structure and was controlling the religious activities. So we quickly went to engage with the government for 2 reasons: to give us that ownership of the government from the beginning, and also to ensure sustainability of the structure beyond the process as well. And that really helped. We had to have a workshop where we brought all the religious leaders, about 20 of them initially, from the different sects, coming together to discuss what are their values about several topics, barriers about MNCH, and trying to separate culture from religion, and then letting them internalize and understand that these are actually harmful practices as well. And the good thing was that at the end of that meeting, they actually said that they want to come up with a booklet, that will be able to pass this information to the Korea communities, which was really good. And so we now had to expand the group to about 64 participants. And one key thing we did also, we got 2 facilitators, one from the traditional houses like the Waziri in Sokoto, and then one facilitator is a well-respected sheikh. And so they facilitated this process with us from behind, and they were able to coordinate all the 3 sects together and come up with this interesting document, Islamic Perspective on MNCH. And then the beauty about it is that right now in Sokoto State, that manual has been adopted by the Ministry of Religious Affairs, and it's being used to preach in different church, different mosques across Sokoto as well. So we are seeing that, of course, this started about a year and a half ago, but you can imagine the potential for change over time as well. Yeah, so thank you, Aaliya.
Thank you, Dr. Atta. Very nicely brought in the sustainability piece, you know, the religious affairs being involved, and this perspective, this booklet, this information is there to live on even after the life of the project, and it's kind of rolling out. With this now, I would like to share a voice from our field also. I'm sharing a short video from Sheikh Dr. Mustafa Siddi Attahiru. He is a renowned Muslim scholar of Sokoto State in Nigeria, and he was one of the lead person in the development of this manual on Islamic perspectives and on MNCH issues. He will briefly talk about his journey in the religious spheres in championing and the kind of deliberated social media that he works on through radio and other behavior change communication messages. So a short video to look at the journey briefly.
My name is Dr. Mustafa Siddi Attahir, a religious leader here in Sokoto. I'm the chief imam of Sheikh Siddi Attahir Ibrahim Jumat Mosque here in Sokoto. I also present various religious programs in the media stations. I'm also a presenter of various sermons. I have more than 5 million targeted audience in Sokoto State and beyond. I was engaged in this show project when I was approached by Plan International for more than 5 years, since the inception. I think it is very important to use my platform so that I will be able to change the perception of many of our people pertaining the family health. As a religious leader, I realize that most of our people are ignorant of the rights of women and children. They don't think the woman has any right, or maybe the children has any right except the right given to them by his husband. While in Islam, it is not like that. Islam has given each and every person his own right and also his own responsibility. But our people are ignorant of that because they don't consult Islamic scholars, or they don't go to Islamia school to learn how to deal with their families. So I think as a religious leader, I can use my platform during Friday sermons because it is an obligatory for every Muslim to go to Friday mosque. So since it's an obligatory for a person to come to my place on Friday to hear from me, I think I have the opportunity now to tell him what Islam says about his relationship with his wife and also his relationship with his children. And also as the people normally listen to radio stations or television stations and other media stations, I think since I have the opportunity, it is good for me to use that platform to call on my people or to try and change the perception of my people on how they deal with their families, especially when it comes to reproductive health, so that they will allow their families to be having access to health facilities, to be consulting doctors. Some people normally use religions as a cover-up. As a cover-up if they want at least impose their bad cultural norms in their family. So they think they can prevent their wives from health facilities, and they will cover up with religion. Religion is different from culture. Culture, we may have a good culture and we may have a bad culture, but religion is always good. So in Islam accepts good cultures and also reject bad cultures. The culture of allowing your wife to health facility is the culture that Islam will accept. A culture that will make somebody or will make someone to at least give a good welfare, to take care of his wife, to take care of his children, or to give them a good and qualitative education, is a good culture that Islam will accept. But denying them from health facilities is a culture that Islam will always reject. Denying them from education is a culture that Islam will always reject. Islam means peace. So I think it is good to use this medium to explain to my people that since Islam is peace, what Islam means is that there will no peace in the family without good education. There will no peace in the family without good health facilities, without taking care of their family's health. So if someone wants to maintain Islam, which means peace in his own house, there must be consultation between the husband and the wife on how to move forward in the family. There must be good education, there must be good health facilities. So as a religious leader, I have to explain to my people what Islam means. Islam is not only for us to pray, Islam is not only for us to fast or to go for pilgrimage. No, Islam is part of all the life of a human being. Whatever you are going to do, that is why confusing cultural norms with Islamic values is not allowed in Islam. So what we normally do is we'll try and separate the good cultures that Islam accepts from the bad cultures that Islam will reject. Islamic perspective on MNCH is a small booklet that we made here in Sokoto so as to guide our people on Islamic teachings on how they can relate with their families on health issues. And we pinpointed some Islamic injunctions on those cultural norms so that people will know what is the reality and also to shun what is not right. I managed to bring the other religious leaders to work with me by organizing a little workshop so that we induct them. We made them to understand the importance of doing that. And also, after they realized that, they joined me in doing what we did. And it yields a very fruitful result.
All right. With that, Dr. Atta, I would want to come back to you one more time. And I know, talking about what you said earlier, and then also Dr. Siddhi mentioning about different levels of success that we've had in approaching and working with religious leaders and combating the power relationship and the dynamics and engaging men in a participative way. I would like to take a moment and ask you, we all know through our work that talking about sexual reproductive health and rights is a culturally sensitive and taboo subject. How does working with different partners in the community, such as religious leaders, support the process of increasing awareness and right kind of information to be communicated to the adolescents and their parents or guardians for that reason? So can you talk about a little bit on what were some of the challenges that we faced in this project, specifically in working with the religious leaders as an important stakeholder group?
Yeah, thank you, Aaliya. So I think just to remind ourselves about some of the issues. So we're going to talk about issues around early child marriage. In Sokoto, they had about 36% of adolescent girls already have begun childbirth. We also have very low contraceptive rates. We're also going to talk about on access to family planning for unmarried adolescents. We're also going to talk about decision making for adolescents in their homes and to make decisions around their lives as well, to decide over their bodies, which have been deeply controlled, by society, especially society in Sokoto as well. So those issues were really touchy issues that we were going to talk about. And so what we did, we recognized that challenge, and so we also recognized in Sokoto there were 3 different sects. And each of the sects, Islam, they had those 3 sects. They also had their power dynamics between themselves as well. So it meant that going into conversation, bringing 3 of them together, if it's not properly managed, you are heading for disaster before you even started as well. And we also knew that working with the religious leaders, we had to make sure that there was enough sustainability in our approach. If not, after the project, we will not be able to sustain the good work we are doing. So I think this was some of the challenges we had. We're able to work. I really need to commend my team, who unfortunately cannot be here, but it was my team, who really they invested a lot of time with informal meetings with the different sects, even before the meeting. In fact, we had a phrase then, we said the meeting before the meeting, which means we are investing time in meetings with different sects so that by the time we came to the larger group, we understood the issues, where the thorny issues were, where the bone of contention, and we're able to manage it better. They also worked with the Ministry of Religious Affairs, like I mentioned earlier, to help us manage that process as well. And then the facilitators I mentioned earlier, we were from the back, and then it was like they appeared, leading them, discussing issues with them as well. So I think those are the challenges we faced, and I think these are some of the ways we're able to navigate around it as well. Thank you, Aaliya. Thank you so much.
And just to add one more experience that we collectively had, that the government would not sit at the table unless there would be a religious leader sitting at the same table.
Yes,
so that was interesting that we had to, work both ways at the same time. So yes, very interesting. And thank you so much for sharing that. This takes me to Cecilia again. Cecilia, I think you talked very nicely about working with the forces and military again in the same landscape as Nigeria. And we all know again that religion and bureaucracy are the two main power holders in any country, and Nigeria more so. Can you also kind of elaborate or highlight a little bit on the kind of challenges that your team faced while working with military in Bolivia?
Thank you very much. It was really great to learn more about the work that Plan is doing. And I think that we share a lot of the similar challenges, working with men to transform social, cultural norms, especially in male-dominated spaces like the military or religion, it's not an easy task. And we know that it requires a lot of work, a lot of commitment, and a lot of passion too. And I have to say that even when we have been able to, engage with the Air Force and with the military and having these strong partnerships with some of the leadership, we still obviously face some challenges in this work. As Dr. Atta mentioned, there are always the power dynamics that exist that are obviously important to address in an intervention like this. We obviously had to know how to work at the different, ranks and with the different levels. Also, it requires a very careful working with the different areas of the institution. I had to say that we also work with a group that face their own challenges. These are young men that some of them come from impoverished communities. Their salaries are very low. We know that their traditional training and also their education in primary or secondary school, has never included training on issues like reproductive health or abortion or gender, So for us, this is a type of intervention that require a lot of investment in resources and time and a lot of commitment and passion, as I said before, because we had to really dig deeper. We had to work with these young men with the institution to actually challenge all these traditional norms and the and the gender and their understanding around these issues. So as Dr. Atta mentioned, sustainability is very important. So we definitely, one of the challenges that we see is like how our interventions are not just like a one-off workshop, a one-off session or meeting with them, but it becomes something that is more sustained, that it can also be part of like the education that this young men go through in the military. And as I also mentioned, there are other structural issues, that are natural to the institution. Some of these students or young military has to move to other regions. They have to go to other places. So, ensuring that the training, the values clarification that we do with them, and also the sensitization goes beyond like one training. It is very important. So we try to have a very sustained, solid training that can help to address this. The other challenge that may be not directly related to our work with them, it is how we make sure that our work is not only limited to the institution, but also able to impact the different communities where they live and where they work too. And obviously that brings other challenges for work, because even when we will want to reach those communities, we are not always in the possibility to do so. But we try to combine this with the other strategies that we have at the community level, so we have a bigger impact. I think that another challenge that I would like to mention is that we need to also be able to do more research and also document more of the work that we're doing. So we can also learn how to expand this work to work with other group of men and also with other areas of the military, so we can also continue to expand this work. So now I would like to pass to Aaliya.
I think now it's time to give it over to Anu.
Sure, I can step in. Yeah, thank you. So I think, first of all, thank you all for these very interesting and rich presentations, and the videos, really helpful to kind of understand the context in which you're working and the challenges that we're facing from Bolivia to Nigeria. So I think what we wanted to do here towards the end is to kind of take this to another level and think about what more we could do, what else we could imagine in this work. And I was really struck by some of so as we think about what more we can do, let's maybe think about the successes that you've had in your programs and how those can be amplified. I think one of the things that I think Dr. Atta said that was really critical was that, or maybe it was you, Aaliya, I'm afraid I can't remember, but it was the point was we want to think beyond specific behaviors. We want to think about the broader issues that we're dealing with, and both of these areas, both of the projects that you've talked about have really gone to the heart and to the institutions that hold patriarchy in a really powerful way, religious institutions as well as military institutions, right? These are very powerful institutions that can either perpetuate patriarchy and patriarchal norms, or they can help to destabilize it or propose an alternative path. And one of the things that really struck me was your conversation with men who felt that they wanted to share the responsibility, right? They felt the burden of the financial responsibility on their homes and for their families. And if they had the opportunity to share that responsibility, it could really fundamentally alter how men and women relate to one another, and then more broadly society as a whole. So maybe, Aaliya, if we could maybe turn to you first and have you reflect a little bit on the successes of the programs, and then think about what else you could imagine doing.
Thank you so much, Anu, on that. I will touch base on a few successes from an overall view, and then I would give the floor to Dr. Atta to kind of dig deeper down. I think to start with, the biggest success that we've had is the ownership of this whole rollout process, both by the community and the ministry even, because as I mentioned earlier, that there wouldn't be a discussion where the ministry wanted to be there all alone and make decisions. They wanted the religious leaders to be there too. So, and having the faith and the trust of the religious leader made it easier for the ministry to kind of take decisions. And by decisions, I mean very important decisions that pertain to health. For example, when we wanted to talk about child health law in Sokoto, the ministry wanted the religious leaders to be part of it. And because the religious leaders were already sensitized and they were with us in this journey, they felt very comfortable in coming to the table and talking about child health rights within Sokoto State with the Ministry of Health. Furthermore, when we wanted to work with adolescents, especially on sexual reproductive health and rights, and as I mentioned, talking about sexuality and sexual rights is a taboo subject in Nigeria. It's predominantly Muslim country. So that was a very sensitive topic. And again, we would directly go to, the Ministry of Health, to come because they do this as part of their mandate. But bringing in that gender transformative and adolescent friendly niche into the existing content was a very big challenge that the project had to take from the beginning. And this was helpful because when we were working with the religious leader in male engagement, there was open communication channels with us and with them and the community on the kind of work we were talking about. And we always went into very interesting debates across the table when we talked about adolescents' right, because I tell you something from my experience and working with different Muslim countries, talking about boys' rights is still okay, but when it comes to talking about girls' rights, it becomes a no-no area. So it was very interesting that these scholars, learned religious leaders would sit on these tables and they would talk about, yes, it's important not just for a woman, but for adolescent girls also. Yes, it's important that they should not be married earlier. So all that understanding, I think, also helped us roll our another strategy that was adolescent peer education strategy that we wanted to roll out with their support and with their approval. So that was those were two important things I wanted to bring in. Dr. Atta, are there any that you'd like to share?
Yeah. I think just to thank you, Aaliya. I think just to build on what you talked about the child right law. I think we made significant progress on that law because we had good relationship with the Ministry of Women Affairs. Our work with the religious leaders ensured that when they were invited to the table, they were quite open to discussions and are favorable to the law as well, which we're currently working to get signed off by the governor of the state as well. And I think with that, if you look at some of the other policies, we had the Islamic perspective of MNCH, which was developed by the religious leaders. We had the adolescent peer educator manual, which we also worked with religious leaders to make sure that we included content around adolescent decision-making, access to family planning for married adolescents, talking about decision in making around marriages, deciding whom and when you want to get married as well. This quite simple, looking simple, but the effort to put them in and to allow the community, the religion, allow those topics to be taken down to the communities and passed on as well. I think that was, for me, a big success. So I think for me, the success is we've laid the foundation to build on. We've started the process of transformation. Transformation will take time because it's, like I mentioned, here is socialization. But I think we laid a solid foundation, and we can only build on that and go higher as well. One other success I want to talk about is unintended the recognition of unpaid work. We saw men begin to recognize unpaid work by women, and now in Sokoto we are seeing men begin to support home care, at the home as well, taking care of their children. Providing for their pregnant wives as well. So I think that's one good thing the community was seeing. So just to highlight those are for me, I think are the two biggest successes for the project. Thank you very much. I think I'll hand over to Aaliya.
Yeah. I think I've got one more important one that I almost forgot about was women decision making. I think what started happening with male male religious leaders being trained and sensitized, they also started bringing in women religious leaders into limelight also. So women religious leader would, sit with women groups and talk about their rights, sexual reproductive health and rights. And because they had direct access with male religious leaders, so there would be synergy in the communication and the behavior change messaging. So that was another important sphere that I would also share some photos on women religious leaders sitting with women congregations and groups. And that's great, Dr. Atta. Cecilia, we would love to hear some successes from your project also while working with the forces in Bolivia. I'm sure you would also have some great things to talk about. Can you share some, please?
Yeah, thank you very much. And I actually just hearing what Dr. Atta was saying, I was just thinking in how we also share some of the same experience, because we know that transformation takes time, as Dr. Atta was saying, and we had to build from what we have been doing to expand this works, beyond the military. And I think that as you have also seen in your programs, we have seen how men and young men, that we work in this project, have also moved to recognize women's rights, women's reproductive rights, and also the contributions that they do for their families and for their communities, but also to recognize how they can make a difference. They can be supportive partners, and also ensure that if they decide to have children, that they also are going to be part of this. Or also supporting women in their right to have an abortion, that is also a strong component of her work. And I also want to mention a couple of like things that we have seen that we can consider, as success in our work. And I think that for us, it has been very important to get the commitment from a military institution, like the one, we're working in Bolivia. I think this is like an important step towards gender equality. Because as we have mentioned before, these are traditionally very conservative, strong organizations that can typically be, basically against or improve, like controlling people. And so having their commitment to change toxic masculinities, to advance sexual and reproductive health and rights, to advance women's rights, um, and also to support the well-being of their communities, it's a key aspect for us. It's a key success. And this also have opened the door for us to work with young men, and definitely we think that this is an important element for our work. The other thing that I want to mention is that one of the good thing for us as part of this work is that we are collecting new evidence. We are learning. We're also adapting new methodologies on how to conduct our work, especially around like values clarification for groups that may be different from the work that we traditionally will do at Ipas. But this also helps us to better work with men, especially in male-dominated institutions. My colleagues in Bolivia have also expanded their work to work with other institutions like the police and the judiciary system, building on those lessons learned from the work with the military, and building on their long history of working with other group of men like indigenous leaders, mining leaders, and other groups. So I think that this work also, we hope that in the future will also help us to continue to collaborate with other organizations, and to expand our partnerships to, to transform this traditional relationships that needs to be transformed too. So thank you.
Thank you so much, Cecilia. So let's, if we can, kind of step back a little and think about what we would do if we could do this work in a brand new way. So clearly these projects have been very successful, but they do take a lot of time, as everyone has noticed. We didn't get here overnight, and we certainly won't be able to unwind this overnight. So it will definitely take us time. And all of you have identified particular institutions or groups of people to work with: the police, the military, religious institutions, government, the social sector. But how would we approach this, do you think, this topic, if we were to reimagine and rethink how to change and transform gender relations. Um, you know, in thinking about it just from the IPAS point of view, it occurs to me that we could and should do a gender analysis of all aspects of our work. So, a lot of the work that IPAS does is around health systems and providers. What if we employed a gender analysis to that and really think not just about the clients, but also about the providers and the gender power dynamics amongst providers? What about budgeting and financing? What about, more broadly, education and how women and boys and girls are educated and taught? I think you mentioned this before, Dr. Atta, about how boys themselves are also an important audience for us. But, if we were to think about this work differently and anew, how would you approach it? And I'm going to start with Cecilia, and then we'll turn to our colleagues, Dr. Atta and Aaliya will close us out of the session. Ceci?
Thank you, Anu. I think that I'm going to use this opportunity to advocate for comprehensive sexuality education. And this is something that maybe we haven't mentioned through the session, but I think that is key. Even when we have seen progress around sexuality education in the past decade, we know that there's still a lot that it needs to be done. And one of the issues that we have seen at IPAS is that even when countries and organizations have been promoted, sexual education programs, these programs are not comprehensive. Topics like abortion, sexuality, gender, human rights are excluded from these programs, and the education is not necessarily comprehensive. They're not, they don't represent the realities that children and youth are living because of the fears and the stigma that exists around addressing these important transformative issues for society. So we need to continue advancing comprehensive sexuality education. We need to make sure that it's gender sensitive, it's trauma informed, that includes a human rights approach, and that topics that are considered stigmatized are not excluded from comprehensive sexuality education. Another important element of this is that comprehensive sexuality education should not be limited only to the school systems. We need to get it out of the schools. We need to make sure that also parents and teachers are well trained and they have resources, that they're linked to services, that they have information that can also be shared across our communities, so we are able to transform these relationships, not only focusing on specific groups, but also expand it to the communities in general. So I think that sexual education, if it is comprehensive, can help us to transform this traditional and social and cultural norms that can be harmful to our communities. So thank you, and I think Dr. Atta, if you can continue.
Yes, thank you, Cecilia. In fact, when you said comprehensive sexuality education, I was like, wow, that's it for me. I think when we were implementing on the show project, I guess that was for me. By the end of the 4 years, I was like, that's the missing portion of this project. Yeah, because we had the project targeting, adolescents 15 to 19, and working with older men, religious leaders, government workers, service delivery providers. But the younger group, 14 below, we really had not invested or planned for that as well. And so that's why in some of our recent programs, we are increasingly begin to include that as part of our project design, going to work with the government. Interestingly, we have the family life health education curriculum in Nigeria. And so what we're doing in some of our project locations is how do we work with the government to actually review, adapt those to align with some of the CSE content as well, so it can be taught in schools and become part of the curriculum, and that way it makes it sustainable beyond the project as well. So thank you for bringing that up as well. I think one other important thing I will see is how do we begin to add a stronger component of economic growth, economic empowerment for women and men in the societies we see. I've seen situations where you see some of the dynamics, urban centers, rural centers, where you have women who are more empowered, more educated. In some cases, you see some of the power imbalances, but it's much lower than you find where the woman is not educated, where the woman is not empowered financially as well. So my thinking is, how do we make sure that we're also incorporating, it might not be within a project, but how are you working in partnership with other partners who are working in this area? You know, I always tell my team that for the outcomes, we contribute to the outcomes. You know, we're not 100% responsible. So for outcomes, for it to be successful, you need to focus on partnerships. So how do we begin to expand this work? By investing more in partnerships in the work we do as well. So thank you, Cecile, for bringing that up as well. I'll pass over to Aaliya. Thank you.
Thank you, Dr. Atta. That was excellent. I do have one more piece to add there. If I were to work with you again on this one more time, I think I would want to go upstream a little bit. And by upstream, I mean this whole network of religious leaders, they come with set behaviors and teachings, right? If I go upstream, I would try to work with these religious institutions when the students are learning these religious education, so that we are trying, in a way, I don't want to call it, but in service, incorporation of talking about power relationship, of women rights, of sexual reproductive health and rights. So that, I think, would make the journey a bit more easier once we do that. I think that's great. With this, I think we are almost getting to our close now. This has been a wonderful forum with learned personalities. Anu, yourself, thank you very much for your vision, for introducing us to the excellent work Ipas did. Cecilia, it was excellent and heartwarming to learn about very important stakeholders. And Dr. Atta, maybe next time we work with military and learn from Cecilia, because I think that's an area which Nigeria would definitely want to go further with.
Yes.
And Dr. Atta, as always, your presence, your knowledge, your experience and cultural humility is a great addition to the team. Of course, all these successes could not have been possible with our indigenous Bolivia and Nigerian teams. So my extended virtual thanks to those teams too. I would specifically want to thank CanWatch for providing us this platform to kind of bring together our strengths and weaknesses and start planning for what next to pitch on. And of course, thanks a lot to the Global Affairs Canada for supporting and giving us this opportunity to come together at the desk. And thank you all very much for a wonderful discussion today. Over.
Thank you.
Thank you very much.